help on the medications that I'm providing to my audience. There is quite a few of them. I sometimes feel like I'm a walking, rattling person. Okay, so the first one is just a regular clean intake that has vitamins, minerals, folic acid, calcium, and iron on it. The second one is called Royal Jelly. It's just a supplement, and this one isn't a prescription. However, my doctor did say it would be okay to take it. It's basically taken for egg quality, to help boost egg quality, I should say. So I take 2 of these a day, and I'll continue taking these until my egg retrieval. I'm also taking L-Troxin, 100 milligrams, and this is because my levels in January were 5.8, I believe. And for IVF, they like your levels to be between 1 and 2. So I had tested my TSH levels yesterday, so I should get those levels back next week, and hopefully things have regulated quite nicely. I'm also taking vitamin D3 on its own because I have very low levels of vitamin D, even though I live in a desert with a ton of sun, and I do spend some time in the sun, not a lot, because it is boiling hot. But for these, I take 5 tablets 3 times a day. Right at the moment, I do have some vitamin D supplements that are coming that are a lot stronger dose. So I'll be able to take just 1 or 2 tablets a day, which will be quite the difference. I'm also taking a low dose aspirin. For this, it's because it helps with blood flow. It may help if I have some underlying clotting issues, which the doctor thinks I do have. They just haven't been able to do extensive testing to figure out which one it is, but they think it's probably factor B lead. I'm also taking a steroid called prednisone, and I've already started these yesterday. And this is basically to help suppress my immune system. I do have some elevated NK cells. They're not extremely high, but in case they were to get high, this will help in that regard. Yesterday, I also picked up my estrogen tablets, and I had to take 1 of these a day for 10 days. And then once my period starts, we actually start the IVF process. These are basically for the estrogen protein cycle. I'm also taking metformin. For me, it's a precautionary drug rather than a preventative drug because my insulin levels are okay at the moment, and I have no cysts. But these help with hoping that we don't have any problems in that regard. And finally, I'm taking an antibiotic, which is because I had a scratch yesterday, so it's supposed to help prevent an infection. I will have to take another dose when we are basically right before the egg transfer or the embryo transfer. I'll have to take another dose of antibiotics. The one thing that I don't actually have here with me is my vial of vitamin B12. It's quite hot here today, so even to have it in the fridge for 10 minutes or so to do this video, it could go off for 1 night, so I'd rather not change that. However, there is a vitamin B12 how to prepare video, which is on my channel, so you can have a look at that if you're actually interested in seeing what that vial looks like. So basically, these are the pre-IVF medications. A lot of them I will continue to take through the IVF cycle and into pregnancy, especially the prenatal, of course, the thyroxine, the metformin I will take, the low-dose aspirin I will take, the prednisone I will take, and So that most of them will go through to pregnancy, at least until I'm 12 weeks. Of course, with the IVF, we'll be adding in more medication. So I will do a second video on medications that I'm taking for the cycle and through the 2-week wait as well. So that's basically it for that. Of course, I may have missed out on some things that I'm not realizing, but I don't think I have. If you do have any questions, please leave them in the comments below this video, or you can join my Facebook group, which I will link here. Also remember, once we get to 200 subscribers on my channel, we will be doing a giveaway. So make sure you click the big red button that says subscribe, and have a good day. Thank you for watching.